In this video, we are going to see the muscles present in the sole of the foot. So, when you look at a deeper aspect, the layers of sole are arranged from superficial to deep as skin, then there will be superficial fascia. After that, there will be deep fascia or otherwise known as plantar fascia. And this plantar fascia consists of three parts: the central plantar aponeurosis and the medial and lateral plantar fascia. Deep to that, there will be the muscles of sole of foot. Before going into the proper topic, let's get oriented with the bones of the sole or bones of the foot that was visible from the inferior aspect. So this bone is the calcaneum. This will be the medial aspect. This will be the lateral aspect. So this is the calcaneum. This is cuboid. This bone over here is navicular. These three are the cuneiform bones: medial, lateral, and intermediate cuneiform bones. Then these bones are the metatarsals. Then more distally, you have the phalanges. This will be the phalanges of great toe, and this will be the phalanges of other toes of the foot. Here it is. These are the muscles of the sole of foot, and these muscles are arranged in 4 layers in the sole. We will be seeing each layer one by one from superficial to deep. The first layer of muscles comprises of 3 muscles, and they are the central flexor digitorum brevis and a medial abductor hallucis muscle and a lateral abductor digitae minimi muscle. The flexor digitorum brevis, it resembles flexor digitorum superficialis of the hand, and its origin is from the medial tubercle of the calcaneum. So we have seen the calcaneum already, and this was the medial tubercle of calcaneum. This was the lateral tubercle. So it is obvious that the flexor digitorum brevis takes its origin from the medial tubercle of the calcaneum. Then distally, this muscle forms 4 tendons: the first tendon, second tendon, third tendon, and the fourth tendon. So these 4 tendons will be for the lateral 4 toes. Each tendon splits into 2 slips opposite the bases of proximal phalanges. You can very well see the division of slips over the distal part of proximal phalanges, and these 2 slips will be for the passage of long flexor tendon for the toes, and the insertion of the flexor digitorum brevis will be to the margins of the middle phalanges of the lateral 4 toes. It's very clear from this diagram. These are the middle phalanges in the foot, and the insertion of this flexor digitorum brevis is towards the middle phalanges. The nerve supply to this muscle will be by medial plantar nerve, and it is a flexor of the lateral 4 toes. Next muscle of the first layer will be abductor hallucis. So the abductor hallucis lies along the medial border of the foot, which is clearly shown from this anatomy model, and that is arising from the medial tubercle of the calcaneum. You can see the muscle and its origin from the medial tubercle. Also, some fibers takes origin from the flexor retinaculum of the foot also, and its tendon fuses with the medial portion of the flexor hallucis brevis muscle, and flexor hallucis brevis is actually a muscle of the 3rd layer. So you can see the deeper lying flexor hallucis brevis, some part of it is visible from the superficial aspect. So this will be the medial part of flexor hallucis brevis, and this will be the lateral part of flexor hallucis brevis. So if you look at the medial part of flexor hallucis brevis, you can see the abductor hallucis fuses with the medial portion. So then it will be, both will be inserted over the medial side of base of the proximal phalanx of the big toe. So this is the big toe proximal phalanx, and you can see the insertion of both the muscles. And our point of concern at this point is this layer is abductor hallucis muscle. That is also supplied by medial plantar nerve, and the action will be flexion and abduction of the big toe. Next muscle of this layer will be abductor digiti minimi, which is present laterally. It is lying along the lateral border of the foot. If you look at the origin of the abductor digiti minimi, you have to remove the flexor digitorum brevis to see the origin of abductor digiti minimi better. So we will remove this. Here it is. So you can now, it's clearly visible that this muscle, that is the abductor digiti minimi, or arises from the medial and lateral tubercles of the calcaneum in a continuous line. Its tendon fuses with the tendon of flexor digiti minimi brevis for a common insertion. Then the site of insertion of this muscle will be towards the lateral side of the base of the proximal phalanx of the little toe. That is this bone. This bone is the proximal phalanx of little toe, and this muscle will be inserted over here. And this muscle is supplied by the lateral plantar nerve, and the action of this muscle will be flexion and abduction of the little toe. That was in general about the first layer of sole of foot. Now we will be removing all the muscles. We have already removed the flexor digitorum brevis. Now we are going to remove the abductor hallucis and abductor digiti minimi to see the second layer clearly. So these are the muscles that are present in the second layer of sole of foot. The first muscle that we are going to deal in this layer will be the flexor digitorum accessorius, that is this muscle. And obviously you can see the two heads of the muscle by which it gets its origin. So the medial head, that is this head, takes its origin from the medial concave surface of the calcaneum and adjoining part of the medial tubercle of calcaneum. The lateral head of flexor digitorum accessorius, that is this head, takes its origin from the calcaneum in front of the lateral tubercle. And along the course, these two heads unite at an acute angle over here. Then when we look at the point of insertion, it has a very peculiar insertion. That is, it is getting inserted into another muscle tendon, and this tendon will be of the flexor digitorum longus. So the nerve supply to this muscle will be lateral plantar nerve. And if you look at the action, by the peculiar attachment itself, it is very clear. That is, it straightens the pull of the long flexor tendons, that is flexor digitorum longus, and also it assists the flexor digitorum longus in flexing the lateral foretoes. Next group of muscles that are present in this layer will be the four lumbricals. We can see from here, these are the first, second, third and fourth lumbricals. Obviously, as you can see, it arises from this tendon, and this tendon will be of flexor digitorum longus. So the lumbrical muscle, their tendons pass forwards on the medial side of the metatarsophalangeal joints, that is over this region, and it will be the same for all the four lumbricals. It is passing over the medial side of the lateral metatarsophalangeal joints over these regions, and they are getting inserted into the extensor expansions and bases of proximal phalanges of lateral four toes. The nerve supply, the first lumbrical is supplied by medial plantar nerve, and the second, third, and the fourth lumbricals are supplied by lateral plantar nerve. If you look at the action, this lumbricals helps in the plantar flexion of toes at metatarsophalangeal joints and extension or dorsiflexion of toes at the interphalangeal joints. Next structure, muscular structure that are present in second layer of foot will be two tendons. That will be the flexor tendon of flexor digitorum longus and flexor hallucis longus, that is this tendon. So these two muscles are long muscles. They arise from the leg, the different compartments of the leg, and they will be passing by their tendon into the foot. So if you look at the foot region over here, the tendon of the flexor hallucis longus will be crossed superficially by the tendon of flexor digitorum longus. And if you look at the insertion of flexor hallucis longus, that will be inserted into the plantar surface of the base of the distal phalanx of great toe, that is this bone. And if you look at the corresponding insertion of flexor digitorum longus muscle, that will be inserted into the plantar surface of the base of distal phalanges of the lateral four toes. Those are these bones. They are inserted into the base of distal phalanges of the lateral four toes. So that will complete the second layer of foot. Now we will remove all these structures to see the next layer very clearly. Now we have reached the third layer of the sole of foot. Here the muscles are the flexor hallucis brevis, the flexor digiti minimi brevis, and the transverse and oblique heads of the adductor hallucis muscle. So these three forms the third layer of sole of the foot. We will be seeing the flexor hallucis brevis first, that is this muscle. So it arises by a Y-shaped tendon. You can see the Y shape over here. And the lateral limb of the Y-shaped tendon is from the medial part of the plantar surface of the cuboid bone. This is the cuboid bone. So it arises from the cuboid bone. And the medial limb of the flexor hallucis brevis arises from the lateral cuneiform bone. The muscle belly then it splits into two parts over here. Each part gives rise to a tendon which contains sesamoid bones near its insertion. The medial tendon, that is this tendon, will blend with the abductor hallucis muscle. We have seen that already. And the lateral tendon, that is this tendon, will be blending with the oblique head of the adductor hallucis muscle. If you look at the insertion, they are getting inserted into each side of the base of the proximal phalanx of the big toe. And the nerve supply is by medial plantar nerve. If you look at the action, that is the flexion of proximal phalanx of big toe. Next muscle of the third layer is the flexor digiti minimi brevis, as you have told already. So its origin is from the base of the fifth metatarsal bone. We can clearly see the fifth metatarsal and see the origin. It forms a narrow tendon and it blends with the abductor digiti minimi. And if you look at the insertion, this narrow tendon is inserted into the lateral side of the base of the proximal phalanx of little toe, that is this bone. The superficial branch of the lateral plantar nerve supplies this muscle, that is the flexor digiti minimi brevis, and it flexes the proximal phalanx of the little toe. Next comes the adductor hallucis muscle. It has two heads, a large oblique head and a small transverse head. This is the oblique head and this is the transverse head. So the large oblique head arises from the bases of second, third and fourth metatarsals. You can see the extensive origin at the lower aspect. The small transverse head arises from the plantar ligaments of the metatarsophalangeal joints of third, fourth and fifth toes. If you consider the belly, they form a common tendon and they fuse with the flexor hallucis brevis lateral part. We have seen that already. And they are getting inserted by the composite tendon on the lateral side of the base of proximal phalanx of big toe, that is this bone. The nerve supply of this muscle is by the deep branch of lateral plantar nerve. If you look at the action, that will be causing adduction of the big toe and also it maintains transverse arches of the foot. Now we are going to remove all these three muscles of the third layer to see the fourth layer clearly. Here it is. This is the appearance of the fourth layer. So first we will see the interosseous muscles. There will be three plantar interosseous muscles that are here and there will be four dorsal interosseous muscles. So obviously we are looking from the plantar aspect, so we will be seeing the plantar interosseous first. They are three in number and lies rather below the metatarsals. And obviously as we can see they are unipennate muscles and they arise from the medial side of the metatarsal bones that are the third to fifth metatarsal bones. This is third, fourth and fifth metatarsal bone and this plantar interosseous arise from that. They are arranged on the adductor side of the toes and they will be inserted over the medial side of the base of phalanges of third to fourth digit. You can see the proximal phalanges and you can see the insertion of plantar interosseous into the medial side of the phalanges. And they are supplied by the lateral plantar nerve and it helps in the adduction of the digit of second to fourth and it flexes the metatarsophalangeal joint. Next we have to see the dorsal interosseous muscle. So since the plantar interosseous muscle are lying superficial to that from the plantar aspect, we have to remove them first. Here it is. This is the appearance of dorsal interosseous muscles after removing of the plantar interosseous and they are four in number. You can see the four dorsal interosseous and they lie between the metatarsal bones. Obviously they are bipennate. You can see the bipennate appearance of the dorsal interosseous arise from the adjacent sides of the metatarsal bones. The tendons are arranged on the abductor side of the toes. You can see the arrangement of the tendons. The first dorsal interosseous, that is this muscle, is inserted into the medial side of the proximal phalanx of the second digit. You can see the point of insertion over here. Second to fourth dorsal interosseous will be inserted over the lateral side of the second to fourth digits, proximal phalanx. And the nerve supply to these muscles will be lateral plantar nerve, and it abducts the digit, that is second to fourth digits. Also, it flexes the metatarsophalangeal joint. In addition to the dorsal and plantar interosseous muscles, the fourth layer also consists of two tendons. They are of the tibialis posterior and peroneus longus. First, we will look at the tibialis posterior tendon. So, this tendon will be reaching the sole of foot for its insertion. So, the insertion will be mainly on this bone over here, that is the navicular bone, and some slips of the tibialis posterior, that is present over here, will be passing to all over the tarsal bones except talus and bases of second to fourth metatarsals. So they will be attached to all the tarsal bones and second to fourth metatarsals. The tarsal bone of talus is devoid of the attachment of tibialis posterior. The next structure, the next tendon that is visible over this fourth layer of sole of foot will be the peroneus longus tendon. Here it is. So the tendon also reaches the sole of foot for its insertion. So it is very clear that it is inserted over the lateral side of the base of the first metatarsal bone. This is the first metatarsal and this is the point of insertion. Also, some part of the peroneus longus tendon will be inserted to the adjoining part of this bone, and this is the medial cuneiform bone. The nerve supply of this muscle will be superficial peroneal nerve, and if you look at the action of this muscle, it will be the everter of the foot. Also, it helps in weak plantar flexion of the ankle, and it maintains the lateral longitudinal arch. So these were the general points regarding the muscles of the sole of foot.